Assalamualaikum and a very good morning to the respected panel. My name is Nur Afina Atika binti Jamaluddin. Will be presenting for my research project, which is abortion laws and policies between Malaysia and Canada. So the first thing first, I'll be talking about the abstract. So abstract, comparing a situation between low and a high income countries, abortion is one of the top causes of maternal death. Abortion remains a taboo subject. Abortion is defined as a pregnancy termination before 20 weeks gestation or a fetus born weighing less than 500 grams by the World Health Organization, the WHO. The combination of a stagnant contraceptive prevalence rate and a falling fertility rate suggests that abortion may be occurring covertly. Malaysia abortion regulations are quite permissive, allowing abortion for both physical and mental health concerns. Canada is the only Western country that allows a woman to have an abortion at any point throughout her pregnancy. Every year, over 25 million unsafe abortions occur around the world. This purpose of qualitative research was to learn more about women's abortion law and policies between Malaysia and Canada. Are there any slides? So, for the method, this study is conducted by the case study research. It is straightforward and unmistakable that abortion is safe. It is available at the woman's request and is universally affordable and accessible. Few existing laws are suitable for this purpose in this view. The road of legal reform, on the other hand, is lengthy and winding. Advocates will need to research the health system, legal, judicial, and socio-cultural issues surrounding existing law and policies in their nation in order to gain the right to safe abortion. So, the introduction. By the end of the 9th century, practically every government had made abortion illegal. The imperial government, such as Europe, Britain, France, Portugal, Spain, and Italy, were the most of the important suppliers of such laws, as they imposed their own laws prohibiting abortion on their colonies. So, according to the United Nations Population Division, comprehensive web page on abortion law, there are three main groups of legal system in which abortion is legal. Legal, prohibited, all of which arose primarily during the colonial period from the 6th century onwards, which can be seen under the three categories which are common law, civil law, and Islamic law. Abortion bans have been in place for three primary reasons in the past, which abortion was risky, and abortionists were responsible for the death of any woman. As a result, the rules were intended to save women who, despite the laws, saw abortion and endangered their life in the process, as they still do today if they have any no other opinions. Abortion was also regarded a sin and a source of moral violation, and laws were enacted to punish and deter the practice. In some or all cases, abortion was prohibited for the protection for the life. So since abortion technologies are safe become more safe, law prohibiting abortion are justified solely as a punitive and deterrent measure or to preserve the lives of a fetus over the lives of women. While there are still many convictions for unsafe abortion, the result of damage or death, existing laws are considerably more frequently applied against the individual who will have a provide safe abortion outside of the law today. Ironically, it is the restrictive abortion regulation from the bygone era that are to blame for the millions of lives and injury caused by the women who cannot afford to pay for a safe legal abortion. Surprisingly, no human rights organization have asked for abortion to be legalized at the request of women, despite that the fact that the numerous of advocated for it to be decriminalized. This raises the question of the term of decriminalization is interpreted differently in different circles. For many years, the international abortion rights movement has advocated a safe legal abortion. So for the background, Canada was the first country in the world legalized abortion, which is back to 30 years ago. Before and after decriminalization, they have a timeline of important legal, political and policy development in Canada. In the absence of the criminal legislation, they analyzed that implication of clinical care, health service, and system decision, health policy, and abortion epidemiology. Hundreds of identical private members' proposals, as well as one government bill, have been introduced since the criminal abortion statute was brought down, but none of them have been passed. So the Supreme Court of Canada declared that Canada abortion statute uh, unconstitutional from January 28, 1968. Because of it infringes on women's right to life, liberty, and the security of person. The statute was determined to be an violation under Section 7 of the Charter of Right and Freedom. So the British Empire Penal Code of 1971, which criminalized abortion on all reasons, brought abortion law to Malaysia. Since then, more rules and regulations have been enacted. Section 312 of the Penal Code have been amended twice on 1971 and to allow abortion to save a woman's life, and again in 1989 to enable abortions to protect women's physical and mental health. Since this amendment, Section 312 of the Penal Code stipulates that anyone who causes an abortion with a woman's agreement can be imprisoned to up to 3 years in a prison or a fine regardless of the reason. Only a licensed medical professional has been authority to evaluate if the pregnant woman's life or health is in danger if she continues the pregnancy. Abortion or rape or incest, as well as in situation of fetal impairment, are still illegal, and in fact done with intent to prevent a child from being born alive, to curse, or to die after birth is a crime under Section 315 of the Penal Code, unless it is for the sake of saving the mother's life. Malaysia, as a Muslim majority country, has a dual legal system with its Sharia law coexisting with the civil law stated before. The National Fatwa Community issued a fatwa in 2002 that allows abortion to 120 days after conception if the woman's life is in danger or if the fetus is impaired. Nonetheless, the Penal Code continued to apply worldwide, and the Center of Reproduction Rights, which is CRR, stated in 2005 that the government had kept the fatwa secret owing to fear that it might be exfoliated. Next, for the problem statement, abortion cases rate has been increased from years to years. Either abortion is legalized and decriminalization, termination of pregnancies is prohibited in Malaysia, but it is not prohibited in Canada. For the research question, unsafe abortion can be prevented. Whether abortion can be legalized in Malaysia as how Canada legalized it? Is it possible to consider the removal of fetus to entail a murder? For the research objective, to study the comparative between the laws and policies between Malaysia and Canada in terms of morality, how the determination of pregnancy is viewed. And third is legal strength of the abortion dispute. So for the literature review, the first thing first is about unsafe abortion. The research problem statement and the literature review complement one another. The subject area to be treated as explicitly defined in the statement of the research problem. The literature study illustrated that the research challenges has been addressed previously, and the additional research is required to fix the issue. The Minister of Health and other stakeholders developed standards and evidence-based guidelines on the prevention of unsafe abortion in 2015 to clarify the situation. Details on who can perform abortion, where and how, and allocated healthcare responsibilities such as degree of care and abortion and post-abortion care were among them. However, due to religious and political opposition, the recommendation were rescinded in 2000, in January 2006. To clarify the situation, the Minister of Health and other stakeholders developed a standard and evidence base. So they included the information who can conduct the abortion. Abortions are safe when performed using WHO recommendation procedure that is appropriate for the pregnancy line and when the individual performing the abortion possesses the relevant expertise. Medical abortion or example outpatient procedures can be used to perform such abortion. Abortion is dangerous when it is performed by someone who lacks of requisite expertise or in setting that does not meet minimum medical standard or both. Even if the provider is qualified, they are less than done using archaic procedures such carriage or in women utilizing pills do not have access to sufficient information or to train person if they need assistance. So moving on to 2.1, which is the complexity of the abortion problem. So according to data 2010 to 2004, over 45% of abortions in the world were unsafe. One third of all unsafe abortions were carried out in the least safe circumstances. For example, by untrained people utilizing harmful and invasive procedure. According to estimates from 2012, an estimated 7 million women were treated in hospital facilities every year and in underdeveloped nations for problems related to unsafe abortion. Unsafe abortion is responsible for between 2.7% and 13.2% of maternal death per year. In wealthy countries, 30 women are predicted to die for every 100,000 unsafe abortion. Unsafe abortion, according to WHO, is a process of terminating an unplanned pregnancy carried out by women who lack the essential skills or in a setting that does not meet a minimum standard medical standard or both. In poor world where the great majority of unsafe abortion occur, an estimated 21 million unsafe abortion occur each year at a rate of 16 for every 1,000 women who, according to the recent research, there was a minimal change in the rate between 1995 and 2003. The most recent year for each statistic of the number of unsafe abortion worldwide are available. Unsafe abortion has been gained more attention recently as an important preventable cause of maternal mortality and morbidity. In light of the worldwide focus on attaining the Millennium Development Goals, which is MDG, a broad agenda agreed that by the world leaders in 2000 aims that reduce poverty, hunger, disease, illiteracy, environment degradation, and discrimination against women, and more and a third of the 1.3 million from the age of 15 to 44 years old in developing world live in the countries where the abortion is illegal and only permitted to save the woman's life, and another 50% women live in a country where abortion is only permitted to protect physical and mental health, but access is extremely limited even under these strict conditions. Next is monitoring and preventive. So perspective I'm sorry, only 3 out of 10,000 pills users become pregnant in the first year of perfect use, but the rate climbs 9 out of 100 women in the first year of normal is in the United States. Failure to stick to the appropriate daily tablet consumed and the correct interval between one cycle and the next, the primary cause of the significant disparity. Contrary to popular belief, techniques that do not rely on user compliance, such as the copper and hormonally released intrauterine device, which is IUD, and the contraceptive implants have a low birth rate, which is less than 1 per 100 women per year for both perfect and normal use. Another technique for reducing the induced abortion among pregnant women is to offer social protection to those who want to have a child but have been abandoned to their partners, rejected by the family, and regard abortion as their last option for survival. Unfortunately, except for the anecdotal evidence, we are unaware of any good studies that demonstrate that the usefulness of a social protection plan. Women should use adoption service should use abortion services rather than according to a popular argument. Many regulations allow women who are pregnant unintentionally to carry this pregnancy to term and then place their baby for an adoption. The babies are placed in orphanage after birth to wait for the foster parents. Unfortunately, the abduction procedure is typically complex, and most of these children go without a home for many years. So next is methodology. I use two types of philosophy, which is interpretism and positivism. So a research instrument used which possibly developed in the pursuit of a goal and the research objective and the research question in the research question. In the Western heritage of science, of four major research ideologies are known as positivism, pragmatism, interpretism, and realism. So conducting interview is the method that I use in completing this research project. Hence, interpretism is used. Next, interpretivists believe that reality can only be fully understood by subjective interpretation and intervention in it. The interviews philosophy emphasize the study of events in their natural setting, as well as the recognition that scientists cannot resist influencing the phenomena of the research. They acknowledge that there are many multiple interpretations of reality, but they insist that these views are part of the scientific knowledge they seek. So for the second method is positivism. For positivists think that the reality is stable and it can be viewed
It's 6 o'clock.
and described objectively according to Levin 1988. That is without interfering with the phenomena and the investigation. They believe the events of should be isolated and observation should be able to replicate. This frequently entails manipulating reality using one single independent variable in order to identify regularities in any built linkage between some of the word constituent elements. So moving on to methods in collecting data. So referring to a number of major articles that describe the case study approach to research, according to Ben Bassett et al. 1987, work with its true definitions and methods for according case research is one of the most important. It's also they believe that the case study is viable for three reasons, which are that it is vital to investigate the phenomenon and its natural environment, to comprehend the nature, complexity, and the processes taking place, and the researchers can ask how and why inquiries. The research is being carried out in an area where they have been few in many previous cases. So next, why dual interviews? When in-depth information on people's opinions, beliefs, experience, and feelings is required, interviews are an effective strategy. Next, data that have been collected, articles and case studies for information on pertinent abortion legislation and regulations in Malaysia and Canada, personal views and recommendation on abortion. So, for analysis and finding, qualitative analysis will be used to analyze the data that I've got from the interview that I've performed, truly scrutinizing the transcript. Once I have completed my research, I will come up with a number of conclusions. So the first thing first, abortion Abortion has evolved since humans first became familiar with the act of sexual intercourse, whether by old days or new era, medically and legally recognized means of eliminating an unwanted child who have been conceived for whatever cause. Abortion is now banned in Malaysia as defined by the local penal code, with an exception that it may perform if the doctor certifies the giving birth is only endanger the mother's health but also her life. So based on the first interview that I have conducted with the lawyer known as Madam Nurhayati, the first question has been asked, what are your thoughts regarding abortion? According to her, abortion is permissible and medical reason or rape cases only. This shows that in her perspective, it is automatically illegal to get abortion done. The Ministry of Health Malaysia (MOH) has given a guideline regarding the termination of pregnancy known as TOP should be done as per mentioned in the guideline, which is it is not illegal to conduct on its own. As far as we know, many women went through abortion process. They tend to buy unverified and uncertified medications, which can be easily get on internet. Around 45% of all abortions in the globe are unsafe, according to the statistic from 2012 to 2014. Abortion as a regular medical procedure. It is safe if a woman uses a method recommendation by the Ministry of Health. One of the most appropriate for the length of the pregnancy and is done by someone who knows that what are they doing. So for the next question is abortion is morally wrong, which led to social issue. The second question that has been asked to Madam Nurhayati, she answers that apart from the two reasons, abortion is morally and religiously wrong. She mentioned that as well as that we know Malaysia is an Islamic country, so it is totally wrong for someone to terminate someone's life. If it is stated under Usul Fiqh that there are three stages of abortion in Islam, which are it is macro to abort a fetus that is between 1 and 40 days old if it does not endanger the mother with the consent of both husband and wife. Second stage, abortion of a fetus before 120 days of age is a must of the fetus if the deformed and disease that could endanger the mother's life, which existence of the baby disability must be confirmed by a Muslim specialist doctor. Third stage, abortion of a fetus that is 120 days or more is illegal because the abortion considered a crime against a fetus that has been blown away by the spirit unless the abortion is to save the life of the mother due to severe disability. By this, it can relate that in Islam, it is illegal and morally wrong to conduct an abortion. Abortion on demand, as practiced in many nations with liberal abortion legislation, will never tolerate it under Sharia law, which is Islam law. So the next question is, do you think that it can be legalized in Malaysia? Just how Canada legalized it? So according to her, it can only be legalized for two reasons mentioned earlier. Canada legalized abortion due to there is no any religion issue as much as in Malaysia. Malaysia is well known as Islamic country, where this issue should would be an unfinished argument, as there will be a lot of opinions and perspective coming from its people. So provocation is not only a necessary component of matrimony in Islam, but is also a form of prayer. According to the Prophet Muhammad, even having a sexual act with one's wife is considered charitable deed. O people, be recognized by your sustainer who has formed you out of life like living being and out of created and inmate. So it is also Holy Quran declares. In some Hanafi and Hanbali Shafi juries also allow abortion under certain restriction. However, due to Islam's concern for life, the majority of Islam juries throughout the history have prohibited abortion unless there are compelling medical reasons. While for the Catholic Church, the most conservative and strict when it comes to contraception, with the exception of abstinence during and before ovulation, sometimes known as the safe period. Similarly, because they consider human life to be conception, it adopts the most conservative position against abortion at any stage of pregnancy. So next is the interview between the respondent, which known as Miss Nanar. So the first question is definition of abortion in her thoughts. Well, she assumed that everybody know abortion is a procedure to end someone's life, which means the pregnancy of some of people need to be aborted due to unintended pregnancy. The law and policy living in Malaysia, which is in Islamic country, abortion is something that is morally wrong, and abortion in Malaysia is mostly illegal. So Ms. Nanar highlighted that there must be an exception for terminating a pregnancy. Unverified and uncertified medication to stop a pregnancy are widely sold on the internet, which can be easily obtained without getting any prescription from the professional. In comparison, Canada legalized abortion in order to lower down this unsafe abortion, which um, until 1988, when the Supreme Court of Canada declared that the statute unconstitutional, inducing an abortion was a criminal in Canada. Abortion has been permitted at any stage of a woman's pregnancy since then. The Canada Health Act makes abortion a publicly subsidized medical treatment. Inducing an abortion was a criminal section under Section 251 of the Criminal Code prior to 1969. A doctor or anyone else who supported a lady aborting her pregnancy faced a potential sentence of life in jail. If the lady found guilty, she faced a 2-year sentence. In 1979, a well-known abortion instance happened. Emily Stowe was involved. She was the only second woman in the Canada to be granted a medical license. uh, Emily Stowe was accused for administering drugs to a young patient in order to perform an abortion. After a lengthy and a high-profile trial, she was eventually acquitted. So next question is describe problems until it led her to go with abortion. Why does it occur? So according to her, she met a guy that did something out of and they did something out of their boundaries, which led to pregnancy, and decided to abort the baby. So uh, it means that she had to go through abortion as she hadn't known any other support as she was still young and living with her family. It women may need to postpone the childbearing because of their culture's marginalization of young unmarried women for having a child, or because early motherhood disrupts education. Women may prefer to postpone the first birth in particular. Furthermore, poverty, unemployment, and inability to finance to educate any further children may be the factor for the family such restriction. Underlying this general reason are specific reasons such as the partner threatening to abandon the woman if she gives birth, the partner of the woman herself refusing to marry, legalize the birth, and the breakout looking for the reason are related to the pregnancy resulting for an extramarital relationship, the husband and partner mistreating the woman because of the pregnancy, or the husband or the partner simply doesn't want the child. So, nevertheless, how have you been feeling about the past? So, according to Miss Nana, she felt quite low and couldn't think straight. So, she was so scared to decide on what to do as she was still living with her family at that time, and also she felt regret. But she said, "That's life. We have to take the risk." So, one of the study published in psychology professor at the University of Toronto in Canada sampled 442 women 2 years after their first trimester abortion and found that 69% said that they would have abortion again. 72% said that abortion provided the benefit than harm, and 80% had no depression at all. The more recent study published in the British Journal of Psychology in 2009 found out that 90% of the 500 women who still believe that having an abortion was the right decision, and in retrospect, despite the fact and that the finding clearly suggested and the unwanted pregnancy leading to an abortion increased the risk of developing subsequent mental problems, whereas unwanted pregnancy leading to live birth was not a risk factor for this problem. These findings reveal a mixture for both positive and negative emotions associated with abortion, according to the researchers who point out that the accumulated evidence on the topics contradicts pro-life advocates. So claims that the large number of women regret having an abortion or for portrayal of abortion having devastating consequences for women's mental health. Last but not least, the question asked to Ms. Nana was an advice would you give to for someone who is deciding to abort a baby? She thinks that it best to advise that to think wisely in that whatever decision that you are doing. Abort is not something that everyone should have been proud of. So as there are so many stories why a woman decided to go to that extent for ending someone's life, if you are still down for it, maybe you need to read more articles and about the process and how it will be done. So facts are critical, especially when discussing the health of women and the general population in the United States. Abortion is in reality an important part of women's health care. Abortion, with over 57,000 members of American College of Obstetricians and Gynecologists upholds that the highest standards of clinical practice and continuing in education for women's health specialists across the country. Medical training, clinical practice, and continuing medical education all include abortion treatment. Abortion via induction is an important part of women's healthcare. Abortion decision is like all medical decision should be made by patients in collaboration with their health providers without undue outside influence. Women seeking abortion, like other patients, are entitled to have their own privacy, dignity, respect, and support. So women resort to unsafe abortion to end undesired pregnancies, where abortion is prohibited and severely limited. Approximately 21 million women undergo unsafe illegal abortion each year around the world, which almost 13% of all maternal mortalities are near 50% per year. Despite the fact that it is most preventable, unsafe abortions remain one of the top 5 causes of maternal mortality. Participants from a variety denomination, including United Methodist Church, indicate views that were somewhere between pro-life and pro-choice. These participants were hesitant to make a firm claims that what the optimal solution to unwanted pregnancy should be explaining that they were not qualified to do so for others. Several participants stressed the importance of individual autonomy is making abortion decision as well as careful consideration of the tax and unplanned pregnancy when deciding on the best way to end the pregnancy. So in last but not least is conclusion. In contrast, this debate can be related to the current scenario in which abortion prevalence rate appear to be on the rise. It may come as a surprise to learn that nearly half of the pregnancies among women in Canada, United States, are unwanted. Hence, terminating the pregnancy is the best option. It has been discovered that half of the women have been list of unwanted by the age of 45, with a third of pregnancies ending in abortion. Abortion instances have grown dramatically in last decade, and this shift, the prevalence pattern, is thought to be the result of variety of social, medical, and socio-economic causes. In United States, epidemiological data shows that 4 out of 10 pregnant women have an abortion. However, because of disparities and conception rates, the prevalence of abortion varies significantly among different social classes of persons with varied socio-economic position. So for many women, more than one factor undoubtedly contributed to their decision. In such situation, it may be difficult to identify a single factor as the most important one, even if a woman identifies one overriding reason. The public appears to have a mixed feeling on abortions, with some states that becoming increasingly politicized on the issue, and the lawmakers imposing and the stricter limits while others desire stronger legal protection. It's worth mentioning, however, that these viewpoints are based on gender, age, political party, and religion. In terms of Islamic religion, the Sharia law, which control Muslim social lives, allow abortion in a variety of scenarios according to SIG 2000. For example, if the mother's life appears to be in danger, the doctor is permitted to perform an abortion. While for the Christianity, on the other hand, despises that abortion because it is immoral. Liberals, on the other hand, believe that abortion is the only way to end the pregnancy because of the young women are not emotionally mature enough to be parents. Furthermore, abortion permits young women to pursue their education and careers, allowing them to be more self-sufficient in their future motherhood. In terms of political party, the democratic parties have been in the forefront of the advocating for abortion decriminalization, citing economic and demographic repercussions of a justification. Abortion clearly has a greater impact on women's health and social life than it does on the society. As a result, terminating our pregnancies appear to be linked in the social rights, and the 1973 Supreme Court verdict reaffirmed a woman's freedom to choose whether or not to have a child, regardless for her reason for doing so. Furthermore, it is correct to say that legal provision it is in most states allow that abortion under certain medical circumstances are rather limited, especially in terms of the legal framework, because they are perpetuate health imbalance in society. Political force, according to experts, shapes how people faith view an abortion question. Religious tradition may be provide basic moral direction on the practice, but rarely provide specific on what a good policies would entail. While the Bible has something to say about this discussion, says the one of official of from a Christian group, it is not as clear on abortion as it is not others. It is not some other moral concern. To conclude, in Malaysia, it is not suitable for legislation of abortion as how Canada does. The law and policies needs to be amended in order to stand up for women's rights. Abortion restriction do not result in reduction in abortion or in significant increase in birth rate. Law and practices that makes it easier to get a safe abortion, on the other hand, do not raise the rate number of abortion. Restricting the legal abortion access does not reduce the number of abortion. Nevertheless, it is likely to increase the number of women seeking illicit and unsafe abortion, resulting to a higher morbidity and death. Many women also forced to seek care in other countries due to the legal constraints, which costly delays access and causes social inequity. Abortion restriction with the goals of increasing population have been widely recorded in a number of countries. So, in each case, abortion restriction resulted in an increase in illegal and unsafe abortion, as well as a pregnancy-related mortality with an negligible net population growth. The legal grounds for abortion, as well as the extent of their interpretation, are simply one aspect of the legal and policies context that influence women's access to safe abortion. Law, rules, policies, and practices may also be used to codify the healthcare system and service delivery hurdles. Women's human rights and should be respected, protected, and fulfilled through the policies aimed at attaining positive health outcomes for women, providing high-quality contraceptive information and services, and supporting the specific needs of the group such as poor women and rape survivors. Human rights must be respected, protected, and fulfilled, which necessitates the establishment of the concessive laws and policies. So that's all from me. Thank you.